everyone, welcome back to No Textbook for Life. I'm your host, Malia Johnson. Around here, we talk about the real life lessons school forgot to teach us, the surprises, struggles, and surprises that shape who we are. Every episode is a little different. Sometimes it's just me. Sometimes I bring on guests, but it's always real, honest, and straight from the heart. So get comfy, take a breath, and let's get into today's episode. Someday I will figure out how to just have a pre-recorded intro so I don't have to say it every time. But that's not today. Anyways, welcome back to No Textbook for Life. Today we're diving into something every expectant mom thinks about, but no one really explains clearly. Birth options. From hospital to home birth, epidurals to natural labor, we'll break it all down so you can make the best choice for you and your baby. And this was something that I really did not know anything about, especially with my first baby. My mom had all her kids in the hospital, and that's all I knew. Same with everybody else I knew. I mean, it was all hospital births. It wasn't until a good friend of mine had a home birth for her birthing experience, and that's when I started talking to her, asking more questions, and realizing that was an option for me too. And I also started looking into a few other options that are available as well. And I'm just going to talk about a few in this podcast. I'll share my personal home birth story, including what worked, what surprised me, and the lessons I learned. Plus, we'll go over research-backed tips so you feel prepared, confident, and empowered. Okay, so there's a lot of misinformation about birth options, and it can feel overwhelming. It also is kind of different for each state. So let's start with the basics. There's a hospital birth, birthing centers, and home birth. Hospital birth, it's the most common in the US. Medical support for emergencies can be highly monitored. Average labor for first-time moms is 12 to 18 hours, and the C-section rates is approximately 32%. Birthing centers is midwife-led, home-like environment, lower intervention rates, average labor is shorter than the hospital, and home birth is extremely safe for low-risk pregnancies. That's very important. With licensed midwives, lower C-section rates, more control over environment, and immediate bonding. Each mother is going to have a different experience, and they might need different options. Okay, so here's the reason that I chose my home birth. I had a hospital birth with my first one, and there were a lot of complications during my third trimester, including the shutting down of my liver, which caused my whole body to feel like it was itchy and just like inflamed, and it got worse at night, which meant I probably averaged about 3 hours of sleep for the last 2 months of my pregnancy. And I just remember being absolutely horrified, traumatized. Like, it was an awful experience. I went in for my 37-week checkup, and I told the doctor, like, this baby had to come out now or I was going to lose it. I was extremely depressed, tired, and it was not going well. To the point where, like, the birth was fine and everything, but the doctor in the hospital didn't seem to communicate well, so I got unnecessary shots. The nurses would not listen to anything I said. I told them I was prone to passing out because I have extremely low heart rate but higher blood pressure. They didn't listen to me, hence I passed out twice. They forgot to turn off my epidural after I had the baby and then had me immediately get up to go shower. So I passed out in the shower as well. And they made me stay at the hospital for 4 days, which I felt was extremely unnecessary because they were getting my testings wrong. So just an awful experience with my third trimester and the whole hospital stay. That is why I looked for a home birth, not to mention the whole issue with insurance. I didn't really have any fears with home birth besides the fact that I knew it would be natural, and I had an epidural with my first. I interviewed 5 midwives before I found the one I wanted and picked a doula. So those were the reasons I chose a home birth, because I didn't want to go the hospital route again. I wanted to be at home, wanted to be in my own bed. I didn't want to worry about insurance. And I wanted to be surrounded by people that I knew and trusted, not random nurses and maybe my doctor. So, plus the bonding experience I had with my second was so much better than with my first. I love both of my babies, but the experiences were so different, and I was able to bond a lot better with my second just because of the fact that I didn't have nurses coming to take her away from me every hour or so. So that is my personal story why I chose a home birth. Now, if you ask my mom, she had wonderful hospital stays and she wouldn't trade it for anything. However, she had birth in Washington, where I believe they have better hospitals and health options, in my opinion. Plus, that was 27 years ago. And yeah, I mean, I'm in Eastern Idaho. So it's really up to you to do the research and figure out what you want to do. I also have to say, though, that home births are for people who are at low risk. I am a low risk person who is extremely healthy. And because I didn't want to end up in a hospital is why I really, really focused on my health. And my midwife was absolutely amazing. So here's some tips for birth options, okay? You want to make a decision matrix. You want risk factors, comfort, personal preferences. And I did go through all this when I got pregnant with my second. If you can, I would tour the facilities if possible, even just virtually to see what feels right. I didn't do any of that with my first. I just went to the hospital that my doctor preferred. I didn't visit, tour it, look it up, or anything. Don't be afraid to ask friends and family for honest experiences, but balance that out with your own research, because everyone's going to have a different experience and something to say. But you don't want to heavily rely on that. Make sure you have a little bit of both to help round out your decision. So let's talk about pain management options. Pain is a big part of birth, unfortunately, but it's also the part everyone worries about for good reason. Here's what research says, right? So epidural, most effective for pain. However, longer recovery sometimes and may slow labor slightly. Nitrous oxide is quick relief, minimal effect on baby, mobile during labor. Natural methods, breathing techniques, movement, water immersion, massage, very effective when combined with support. And here's a little fun fact. Continuous labor support reduces the need for pain medication and lowers C-section rates. So for my home birth, I had to figure out how to cope without medication, and my midwife is very holistic. So she had these little tinctures that she would put on my tongue or something, and they were awesome. They just were able to bring down some of the worries and some of the pain. My doula if you go the home birth route, I'd say you have to have a doula, because mine, she would massage my back. She knows exactly where to put pressure to help release the pain and tension in your body. She would push on my knees a specific way when I was sitting, and that helped with pressure. She also knows when to do it by listening to breathing and like the tone of your breath. That helped. She also would pour, like when you're in labor, you go from really hot to cold, back and forth, back and forth. So she knew when to like pour hot water down my back when I was in the tub versus get a cold rag to put on my forehead. I was transitioning, so I was dilating at 10, transitioning to the part where I was ready to give birth, laying on the couch on my side, and it was extremely painful. With the help of my husband and the doula, I was able to get through the pain, and then in between a contraction, they were able to move me into the tub, and that was the first time in about an hour and a half that I could actually breathe again and relax. And I remember going through like maybe 2 or 3 contractions, just laying there relaxed until it was ready to push. So I loved the tub. I would not do a home birth without a tub, personally. With my first baby, I did have an epidural, and it was the pain was extremely minimal. If I laid on one side for too long, then it would like not work on that side, and I could feel the contractions. But when it was time to push, I didn't feel anything, and the stitches afterward, I didn't feel anything. But my head felt like it was going to explode when the nurses would tell me to push, because I'm not working with my body at that point because I can't feel what's going on. My head did not hurt once. I didn't feel any pressure at all with my home birth. So with the epidural, also, when my baby came out, she was pretty like groggy and sleepy and not alert. Whereas with my home birth, my baby was extremely alert, and she stayed awake for quite a while, actually. And I have heard it's because like something to do with the epidural makes them a little groggy. And right after I had my baby with my home birth, I was able to get up, walk around. I felt great, even though it was 4 a.m. Whereas with my epidural, I was numb for a long time. I ended up passing out. It was kind of a disaster, to be honest. I also hate IVs, so I didn't have to have an IV when I was at home, obviously. Okay, here's some tips and tricks for pain management. You want to create a comfort toolkit playlist, which I didn't use music, or did I? I don't remember music playing. I did have a birthing ball. Look into water options if you can. I feel like the hospital should have options, but I didn't ask. I just didn't know. Partner massage ideas. It's always great. We went to a birthing class where Colt learned a lot of those techniques to help me during labor. Breathing is probably the biggest thing that you can practice and work on before labor. Breathing is what saved me during my home birth, and we practice breathing at the birthing class. And they teach you want to have a low guttural growl, basically. You never want a higher pitch of like moaning or groaning when you're in labor, because they said that when you have the higher pitch, it's closing all the holes in your body, making it harder for birth and labor. So if you keep it low, everything relaxes and releases tension. And honestly, that is the only reason I think how I got through labor and pushing. You can also practice visualization before labor. Know your priorities. There's pain relief, mobility, control over environment. Rank them so you can advocate for yourself. Especially in the hospitals, they're going to try to just make you do what's most convenient to them, at least in my experience. Let's talk birth planning and advocacy. This is a big part. A birth plan isn't a script, it's a guide for how you want your birth experience to unfold. I'm not saying it's going to go to plan, but like I said, it's going to be a guide for you. Studies show having a written birth plan increases satisfaction, decreases anxiety, and improves communication with providers because you'll write out this birth plan and give that to them. Important elements to have is pain management preferences, labor environment, who's present, interventions you accept/refuse, and then newborn care preferences. My home birth plan was the only plan I actually made. And the midwife helped me with it. And she also told me what some of the options I didn't have, right? Because I didn't have an epidural option or nitrous oxide options. And we also talked about in a emergency, we would have to hightail it to the hospital. And that's what we were trying to avoid. Which thankfully nothing wrong really happened at my home birth. So I am grateful for that. I included who I wanted to be there, my mom, husband, and then the birthing team. I didn't have a birth plan at all going in with my first, and so I do feel like that the nurses and doctors made a lot of decisions for me, and I didn't really appreciate that. But the problem was I didn't know my options either. Some tips for the hospital or hospital-like births. Make sure you advocate for immediate skin-to-skin, rooming in, and avoiding unnecessary interventions. We had a nurse who would come in at night and take our baby to the nursery without asking. So, I don't know. Some tips and tricks for your birthing plan. Share your birth plan with all key people so that they know your preferences too and they can advocate for you as well. Practice self-advocacy phrases. I like to wait for blank. Can we try blank first? You want to keep it simple. Okay, 1-page overview. Overview works better than pages of detail because honestly, when you're in that whole birthing situation, sometimes people don't have tons of time to read a giant packet. You just need the most important things clearly labeled out. All right, so anyways, in closing, your birth is unique. There is no one right choice. What matters is that you're informed, confident, and surrounded by support. Hospital, birthing center, or home, your experience can be positive if you know your options and plan ahead. This is, I just feel like, essential when it comes to birth is having a plan, looking at all your options, and making sure that you're talking to your spouse or people close to you that can help you in this time. Because let's be honest, when you're pregnant, not everything is firing correctly in your brain to make all these decisions. So make sure you ask for help. Tonight, write down the top 3 priorities you have for your birth. Then research one way to meet each priority. That's the first step toward feeling prepared. And also, like I said, it depends on your location too. So there is a lot of research to go about when you're looking for either midwives or a specific hospital or a birthing center, etc. So make sure you do the work, and also prepare earlier than later if you can. Well, there you go. You survived another episode of No Textbook for Life, and I only did this in one take. Next time, we'll dive into preparing your mind and emotions for the big day, because birth is as much mental as it is physical. And if you want the video version, go to my YouTube on Modern American Mama. Thanks.